Oh, thanks so much for coming and talking to me today, Elise.
Okay, that's fine.
Just tell me a little bit about you. You're obviously a GP, you're a mum of one, you also have one on the way, which is amazingly exciting. So tell us a little bit more about you.
Okay, I've been a GP since 2009. Okay. I've worked in various areas, always had an interest for maternal and child health, working in developing countries such as Papua New Guinea and Nepal, developing health systems. But just generally having an interest, especially when you have one of your own, then it really comes into your own because you start Googling and all the sorts of symptoms that...
Yeah, it's relevant to your life suddenly.
Exactly,
yeah.
Exactly. So, me, I had lots of pregnancy symptoms, my son had lots of baby problems, so I became sort of an expert just because you have to when you've got your child with issues. So
amazing. Okay, so what we've done today is we've compiled a list of questions that I know I certainly Googled, and I know that a lot of my friends and definitely Googled when they were pregnant and when they had a newborn. So I thought we'd go through them and get your expert opinion. Okay? Excellent. All right, so the first question is, what does pain during pregnancy signify?
Okay, I mean, obviously that's quite a big, broad question, so I'm going to break it down a little bit. Yeah. A few aches and pains here and there throughout pregnancy because of the strain on the ligaments, the pressure in the uterus, that can be quite normal. Yeah. If you're well with, this pain. If you're unwell, so if you have painful when you wee, fever, vomiting, diarrhea, spotting, bleeding. Yeah. This can often signify something more serious and something maybe non-pregnancy related. So appendicitis, gallbladder, kidney stones, urine infection. It doesn't necessarily mean that something's wrong with the baby, because I know that when people experience pain when they're pregnant, they're like, oh my God, something's happening to the baby. But it's not necessarily. But you've got to look at the whole picture. Yeah. So often when it's, a system outside the womb, like I say, appendicitis, it won't be affecting the baby. Yeah. But you'd still need to obviously get it checked out by a doctor. I mean, if we split it out into, first, second and third trimesters, the two most important pains in the first trimester is, unfortunately, miscarriage is common. Yeah. And 1 in 4 do end in miscarriage. So if it was accompanied with bleeding, this could signify a miscarriage. And if you're bleeding more than 1 pad an hour, I would take yourself off to A&E. Yeah. If not, most people have an early pregnancy unit that they could ring and get an early scan. The other cause, and it's often one-sided, is an ectopic pregnancy. Yeah. And it's never going to be a viable pregnancy, but it's something that's very serious and a surgical emergency. So again...
So what is an ectopic pregnancy, just for people who don't know?
It's a pregnancy where it's not forming in the uterus, it's forming in one of the fallopian tubes. So you'll often have pain on one of those sides. Yeah. And it will often present itself before 10 weeks. Okay. So you'll get pain, you might get a watery, bloody discharge. Yeah. You might feel quite sick and unwell. Yeah. But if it's, serious pain, then I would go to A&E. Yeah. In the second trimester, luckily, miscarriages are often rarer. It's about 1%. But again, accompanied with bleeding. Yeah. If it's more than 1 pad an hour, I would go to A&E, because by then it would be a heavier loss. In the third trimester, anything from 24 weeks to 37 weeks, it could signify premature labour. Yeah. These could be false alarms if you're not actually, your waters haven't broken.
Do Braxton Hicks actually hurt? I actually never had.
Neither did I.
Any Braxton Hicks.
But they do.
They're like a contraction.
Yes, they are like a contraction, and they're like false alarms, but the water hasn't broken. Yeah. Anything from then 37 weeks is just called early labour, and it's your body getting ready to deliver the baby. Yeah. So, in general, if you are well, pains probably don't mean anything, but it's just looking at the whole picture and where you are in your pregnancy.
Okay, so don't panic.
Don't panic.
Don't immediately think something's horribly wrong.
No.
Okay, perfect. Thank you. Right. What is gestational diabetes? Now, this one's particularly interesting for me because a very close friend of mine was told that she had gestational diabetes, and she's very slim, very healthy. So I always thought it was people that maybe were slightly overweight or had an unhealthy lifestyle. That is a risk factor. So tell us a little bit more about it.
Well, when you're pregnant, your placenta, the hormones, basically tell insulin that you already produce not to work so well.
Yeah.
So therefore, your body needs to sort of crank up and start producing more.
Yeah.
If your body doesn't respond to this, you don't produce enough insulin, and therefore your blood sugars get high, because what insulin does is it removes glucose from the blood. If your blood sugars are high, then that can be dangerous for you and the baby.
Yeah.
I mean, when you say your friend was slim, yes, risk factors can be overweight. So BMI of over 30 can increase this.
Yeah.
Family history of diabetes, previous gestational diabetes, inactivity, abdominal fat. It's all the fat around the pancreas.
Can it have something to do with age as well? Because she was a slightly older mother.
Yes, over 35, that also increases it, but unfortunately we can't help that.
No.
I wish we could. And certain races, so South Asian, Black African, Caribbean and Eastern, sort of Mediterranean, they have a higher risk of developing diabetes.
Yeah.
But we usually check for it between 24 and 28 weeks, unless you are having one of these risk factors.
Yeah.
And it can be treated. We usually treat it with diet, because the main aim of it is to keep your blood sugars level.
Yeah.
So therefore, you'll be referred to a dietitian, be advised on certain carbohydrates, because obviously carbohydrates increase the glucose in your bloods. But complex carbohydrates, regulating your meals, not skipping, sensible food choices, pairing it with protein. Just, and if that doesn't work, then unfortunately we may have to, start an oral medication called metformin or insulin, which,
And what's the result of a mother having gestational diabetes on the baby?
If it's not controlled, then it can lead to a larger baby.
Okay.
And then a larger baby can, if you're giving birth, it can lead to shoulder dystonia, where the shoulder's pulled out. But it's usually picked up now. Yeah. So, I mean, there are other things, but So we usually catch it early, because it usually happens from about the second trimester onwards.
Okay. All right, brilliant. And I think we've kind of covered this, what can I do to prevent gestational diabetes? I mean, it really is diet and exercise, isn't it? It's the same with type 2 diabetes. It's kind of type 2 diabetes.
Yeah. So the preventative factors would be, abdominal fat, activity, and a BMI over 30. If you
Lots of small meals just to try and keep your blood sugar level rather than it doing this.
But if you have any of the other risk factors, unfortunately, you still might develop it, like your friends. Polycystic ovaries is also another risk factor.
Oh, interesting. Okay.
But, so unfortunately, age, all of these other things we can't control.
Yeah.
But.
Okay. And what is diastasis recti is the next question.
Okay, so this is where there's a separation of our abdominal muscles.
Yeah.
And this can happen from multiple pregnancies, from one pregnancy, but pregnancy puts a huge amount of strain on the abdominal wall. There are kind of crude ways of testing for this, by lying on the floor and almost doing a press up and seeing whether you've got a gap, the finger test. But if you really do think that you've got a bulge as a weakness, it can lead to things like poor back pain because of the poor core control, constipation. And if you do think that you have this, it's it's usually called the belly paunch after you've had a baby. I would actually go and have an actual diagnosis from a physiotherapist, because it's a bit of a crude measurement to do yourself.
It's quite hard to do.
Yes.
Now, I always suggest that women continue doing core workouts throughout the pregnancy, and when they know they want to become pregnant, because actually having a strong core does prevent diastasis recti, and it's not a very nice thing to have.
No.
And it really does affect you getting back into shape after pregnancy as well. It makes it so much harder around the stomach area.
Oh, definitely.
So doing lots of core workout is really, really important.
And I think that's really important to say, because I think a lot of people think that because it's this area, lots of crunches will work, and that's the complete opposite.
Absolutely,
I mean, you would know best, but it's lots of the core exercises, because stomach crunches are only going to increase the pressure and potentially make it worse.
Yeah, absolutely. Okay, amazing. Now, how do you know if you're pregnant? Now, this is obviously other than doing a pregnancy test, which I think most of us would do, but a lot of people do search for this. How do I know if I'm pregnant? So what other than doing a pregnancy test would you recommend?
I mean, every pregnancy is different. And every pregnancy for everyone each pregnancy for the same person would make me maybe different. And symptoms can come on as early as almost conception to, weeks later after the positive pregnancy test. But typical symptoms would be nausea, certain smells.
And would you get nausea immediately then? I wondered whether that was actually something that you get maybe 2-3 weeks after conception.
I've had people as soon as they conceived be nauseous. So that's why I'm saying it's different. So there are people, it's unusual, but people do. And people just say, I know I'm pregnant. Breast tenderness again is another one. Going to the loo a lot, for a wee. Constipation because the progesterone slows everything up. Head exhaustion as well is a major, early symptom. Feeling just generally rough and tired.
And getting ill. I think that's a big one, because I know when I first became pregnant with Ava, I think I got 4 colds in a row. And I just, what is wrong with me? I'm constantly ill. And it's because your immune system is
a little bit low.
So that your body doesn't reject
your baby. So that carries throughout, obviously, the pregnancy. But, when you're talking about very early signs, obviously, you probably know you're pregnant by that point, and obviously a delayed period. But you still can get a little period at the very beginning, and it's often implantation period.
Does that happen normally on the first day of when your period would normally be?
Often, so then it's confusing.
Very
It's actually happened to me for this pregnancy.
Oh, really?
So it can mean that you do the pregnancy test, I'm not pregnant, that's fine, let's go on. And then you don't realise until a week or so later.
So with all those symptoms, I think it can be really psychosomatic, because I think you can think, oh my God, I'm feeling slightly sick. I must be pregnant. My boobs, I must be pregnant. Just do a
and also
test.
exactly, and also your period could be due. So it depends whether you're quite a hormonal person. You respond quite a lot to hormones anyway.
Absolutely. Okay, brilliant.
But yes, to know for sure, do a pregnancy test. They're very sensitive, and you don't need to go to a GP to have it confirmed.
They're so much more sensitive nowadays, aren't they? Because it used to be you had to wait until your period was due, but now...
yes, you can pick it up a little bit, but they are early predictors, but if you actually read on it, they're not, it's not 100%.
Oh, okay.
So...
Can you get false positives?
Exactly. So not false positives, but often false negatives. So if...
there's not enough of the hormone.
Exactly. So I would probably wait until your period's due.
Okay, perfect. What does having a low-lying placenta mean?
Okay. A low-lying placenta is really relevant sort of after the 20-week scan, because before then everything's quite small and generally moves upwards anyway. It can mean anything from covering the whole of the entrance of the womb, called the os, to partially covering it. And it's important because obviously if you've got your great big bleeding fleshy placenta covering the exit of where the baby comes out by birth, that's going to cause problems. So if you are shown to have this covering, you will have probably more scans, just check that the baby's growing correctly. You might have even picked it up because the baby's lying transverse, so across, or breech because the baby hasn't been able to get their head down because the placenta's been covering it. But we would generally keep an eye on you, because if it was covering it by the time of birth, then a natural delivery wouldn't be possible. You'd have to have an elective C-section.
Oh, right, okay. And there's nothing you can do to stop this, is there?
No.
Okay. So what is pelvic girdle pain?
Okay. This used to be also known as symphysis dysfunction. And it's basically, when we get pregnant, the hormone relaxin is released. It releases all the ligaments, which is great for when you give birth, because you want that area to open up. However, leading up to the birth, it can cause significant amounts of instability within the pelvis and lots of pain. Especially if you're like me in my first pregnancy, you have hypermobility as well.
Oh, okay,
but the pain isn't just at the front. It can go all the way around to the back, near where the back attaches to the hip joints. Things to avoid it, I guess, well, not I guess, but keeping the hips stable. So crossing the legs wouldn't be good. Lying without support in bed. Putting a cushion between your legs and under your bump and behind your back. That would be the best support. If you've got a toddler, trying not to pick them up too much. Certainly, exactly. So, putting them on one hip. Basically anything that puts pressure, because the bigger you get, the more pressure that is already on an, unstable pelvis. People end up, on crutches. It can be a severe cause a disability and, you know, trigger off some, you know, prenatal depression, because people really do feel in pain and trapped. So it'd be best to, you know, talk to your work about different solutions, getting on the train when there's no seats. But if you do get referred to a physio or someone that understands about this, there are lots of exercises, like you mentioned before, core exercises, Pilates type exercises that strengthen these, you know, muscles and ligaments around that area, so you know, don't have a tendency to pull it, as it were.
Now, but on the positive side, once you've given birth, generally you go back to the way that you were before.
Yes, because the pressure's gone. I would still continue doing those exercises though, because the hormone relaxin again stays in your body if you're breastfeeding until often about 6 months afterwards. So if you've known, but by then you're probably so acutely aware of your hips that you do anything to get rid of it. And of course you can take things like paracetamol for the pain and heat pads or ice packs, whatever helps.
Anything to ease it, really. There's no cure, is there? There's nothing.
No, unfortunately not. No,
sadly.
But there's a lot of things you can do to support it and strengthen it so it prevents it getting worse. Early referral if you think that's
something you might
be having.
Okay. What is preeclampsia?
Okay, preeclampsia is quite serious, and we, you know, that's why we have urine tests every time we go to our midwife and blood pressure checks, because the two symptoms are high blood pressure and protein in the urine. Other symptoms could be headaches, sudden onset headaches.
It's like having high blood pressure, isn't it?
It is, but it's with all these other signs, because preeclampsia is pre-fit. So what you're trying to avoid is this almost like a fit that can actually, well, be fatal to you and the baby. Incredibly rare nowadays, because we have all these tests and antenatal checkups to pick it all up. So if, you know, certain risk factors, so again, being an older woman, having a baby over 40, if you've had a 10-year gap between your first and your second, if you're diabetic, if you've got autoimmune diseases, if you've got high blood pressure anyway before you were pregnant, these are, you know, there are certain risk factors that they may even put you on aspirin at the beginning of your pregnancy to prevent this. But you can't pick up protein in your urine or blood pressure, so that's why it's very important to keep up with your regular checkups. The other symptoms that you may pick up though is sudden onset headaches, pain suddenly underneath the ribs, sudden onset swelling or of the hands and feet. Everyone gets a bit of swollen feet, but not suddenly.
Mine were ginormous. Seriously, my ankles were like this big.
Cankles.
They really were. I was like, what is going on?
So, but it's the sudden. So obviously, and it's the sudden change. And again, protein in the urine doesn't have to always signify that you've got preeclampsia. You know, we do it from trace to 4+. A trace or 1+ might even just signify that you've got a urine infection. So your midwife will send off your urine. But a very high protein count could signify something to do with your kidneys. But that's why it's important to keep the checkups, because those symptoms alone, plus the high blood pressure and protein, can pick it up very quickly, and we would then make the best call whether to transfer you to hospital and monitor you and the baby.
So, how can I prevent preeclampsia? So you kind of touched on this a little bit.
Again, it's about the risk factors. You can't,
exercise is good.
Exercise, being healthy, lower BMI. Those are the things we can help. Otherwise, age, having...
Not much we can do about that.
But then, the diabetes before and the blood pressure before, again, reducing those risks are, again, your weight. And diet and exercise.
I think all of these things are suggesting that before you become pregnant, try and be as healthy as you possibly can be.
Absolutely.
Because that's going to help you so much in your pregnancy and after pregnancy.
So if you're planning and you've been planning for a while, then really you can do lots of things to try and reduce this and prepare your body.
What does protein in the urine mean? So
Again, yes.
Could be preeclampsia, but it might
not be. A small amount is usually a urine infection.
Yeah.
And they would just dip it again.
They're quite common, aren't they, in pregnancy?
They are, and often without symptoms.
Yeah.
So obviously the classic symptoms are burning, frequency, a change in smell, low abdominal pain. They're typical symptoms, but often we could have a very slight infection starting without realising, which is fine and treatable and doesn't harm the baby.
Yeah.
But we'd have to treat you with antibiotics that were okay when you're pregnant.
Yeah. And what happens if you do have an untreated urine infection? Is that bad for the baby, or is it more bad for the mother?
It depends how far it goes, because an untreated urine infection, unfortunately, has to be treated with antibiotics. If it's not, it can travel all the way up to the kidneys.
Right.
Severe pain, fever, vomiting, unwellness.
Yeah.
Your kidneys are supporting your baby.
Yeah.
So yes, in the end, it wouldn't affect your baby,
but again, it would
at
be
late
picked
stages,
up.
and it would be picked up.
Yeah.
You would be very unwell before that happened.
Yeah. Okay. So varicose veins, lots and lots of women get varicose veins in pregnancy.
Yes.
How can we prevent varicose veins in pregnancy?
Not very easily, unfortunately. and varicose veins,
is
it's the hormones. It's it's
more blood in the system.
More blood in the system. You're providing for 2 people now.
Yeah.
And the pressure on the uterus. You've got a great big uterus here, and your blood's in your legs. You don't have a heart in your legs.
Yeah.
The only way that the blood's going to get back up is by pumping the calf muscle.
Yeah.
Calf muscle pushes the blood back. If you've got something sitting right at the top, of the canal of blood, it's going to pool more easily, hence the fact that we get nice swollen ankles.
Yeah.
Obviously, it depends on your type as well. If you're, one of these types, if your mother got varicose veins, unfortunately, you'll probably be prone to them. And varicose veins also means piles and hemorrhoids. That's a varicose vein of the bottom, the rectum. So again, it's all to do with the pressure.
So a friend of mine got really, really bad varicose veins.
Yes.
I mean, you could see them really strongly down her legs, and she was told to sit with her feet up as much as possible. Is that something that you would suggest?
If you're sitting, yes, but the way to get the blood pumping again back up is to walk. So I wouldn't say complete bed rest, because then you're at risk of things like DVTs, which is a deep vein, thrombosis from immobility, which is also high because you've got the pregnancy hormones, and because you've got a great big mass sitting on the upper bit of your legs. So no, I wouldn't recommend complete bed rest. You can get supportive hosiery, supportive stockings. That would probably...
like you wear in an aeroplane?
Yes, something similar to that.
Thick.
So quite thick, but you could also even buy tights. I mean, it depends how swollen these veins are. So if they're just little ones, spider ones, probably not going to make much difference. If they're big ones like your friends had, then yes, I'd probably suggest a thicker, tighter garment that you do not wear at bedtime. You put them on before you get out of bed and then you get up, because that's acting as the calf muscle does, squeezing the blood back up and helping.
Amazing.
Hopefully.
Well, thank you very much.
Yeah,
that was really helpful. And if anybody does have any questions for Elise, then do email us, and she will get back to you.